So in terms of the blood supply to the ovaries, the arterial supply is via the ovarian arteries and the venous drainage is via the ovarian veins. So the ovarian arteries arise just below the level of the renal arteries on the abdominal aorta on either side. So remember, the renal arteries lie at the vertebral level L1, so the ovarian arteries arise just below the renal arteries. And then in terms of the venous drainage, the left ovarian vein drains into the left renal vein, whereas on the right side of the body, the right ovarian vein drains into the inferior vena cava. So remember that these ovarian vessels actually pass to the superior pole of the ovary via the suspensory ligament or the infundibulopelvic ligament. So moving on to the uterus, we're now looking at it from this lateral cross-sectional view. In the last tutorial I introduced you to the various parts of the uterus, including the fundus, the body and the cervix, and I mentioned that it had this flexion over the bladder, which we can see here. But what I didn't introduce you to was the different axes of the uterus. So at the level of the internal os, you can see that the body of the uterus is angled forward at an angle of around 130 degrees. So the axis of the uterine body lies at a 125 degree angle to the axis of the cervix, and this degree of angulation is called anteflexion. And then the degree of angulation you get with the axis of the cervix to the axis of the vagina is called anteversion. So normally this is around about 90 degrees of flexion, so it's not shown as sharply angulated in this model here. So you've got anteflexion, which is the axis of the uterine body to the cervix, and then you've got anteversion, which is the angle formed by the axis of the cervix to the axis of the vagina. So just coming over to one of my diagrams again, we're looking at a poorly drawn sagittal section of the pelvis. So anteriorly you've got the pubic symphysis and the pelvic bone, and you've got the bladder in orange and the rectum posteriorly in brown. So just to illustrate some of the positions that the uterus can take. So the normal position is, if I just draw on the vagina here, and then you've got anteversion of the cervix in relation to the vagina, and then you've got anteflexion of the uterine body. So that's the normal or most common position of the uterus. And then another position of the uterus can be to have the anteversion and retroflexion of the uterus. Or you can also get retroversion and anteflexion, or you can get retroversion and retroflexion. So those are some possible positions of the uterus. So in terms of the blood supply of the uterus, it's supplied by the uterine artery. So if I just rotate the model slightly to the side, you can see this artery running along the length of the uterus. So this is the uterine artery, and it arises usually from the anterior division of the internal iliac artery. And this artery actually runs in the base of the broad ligament. And if you remember that I mentioned before, the uterine artery crosses above the ureter. So remember that mnemonic, water under the bridge, to remember this anatomical relationship. So you can see the ureter is running underneath the uterine artery to enter posteriorly into the bladder. So as it ascends along the uterus, it forms anastomoses with the ovarian arteries, which you can see above. And it also gives off descending branches which supply the upper vagina and the cervix. So venous drainage of the uterus corresponds to the arteries. So these veins drain to the internal iliac veins, and there's communication between veins that come from the vagina and veins that come from the bladder as well via a venous plexus. So in terms of the arterial supply to the vagina, the arterial supply is from branches of the internal iliac artery. So you've got various branches such as the vaginal branches, the uterine branches which I mentioned, and then you've got the rectal branches, the middle rectal branches, and internal branches of the internal pudendal artery which supply the vagina, and venous drainage is via the venous plexuses which drain into the internal iliac vein via the vaginal veins. So now you should have an understanding of the blood supply to the organs which make up the female reproductive system, and also have an idea of the different axes and different positions that the uterus can take. Okay, so in this tutorial we're going to take a look at the female external genitalia. So what I'm going to do is I'm going to rotate this model so we're looking at an inferior view of the external female genitalia. So the way that I'm going to explain the anatomy of this area is through a diagram. So looking at the same view, I'm going to talk you through some of the anatomical features of the female external genitalia. So posteriorly we've got the anus, anterior to that we've got the vaginal orifice, and at the front, most anteriorly, we've got the urethral orifice. So the urethral orifice and the vaginal orifice are surrounded by two thin folds of skin called the labia minora. So I've just drawn these folds on here. So the singular of labia minora is labia minus. So these are also known as the inner lips or the inner labia. So labia just means lips in Latin. So then you've got the outer lips, which are called the labia majora. So the labia majora run from the mons pubis, which is a layer of adipose tissue which lies over the pubic symphysis, to the perineum posteriorly, where they're connected by the posterior commissure. So you've got this depression posteriorly. So anterior to the urethral orifice you've got the glans clitoris, and the labia minora form folds around the glans clitoris. So at the anterior end of the labia minora they bifurcate to surround the glans clitoris. So this bifurcation produces two folds. You've got a lateral and a medial fold. So anteriorly the lateral folds meet in front of the clitoris and they form what is known as the hood of the clitoris, or the prepuce. The medial folds, however, join together and attach to the posterior aspect of the glans clitoris to form the frenulum. So the body of the clitoris extends forward anteriorly from the glans clitoris, and it's deep to the prepuce. So it's underneath the hood. So posteriorly the labia minora join together to form the fourchette. So the area actually surrounded by the labia minora, containing the urethral orifice and the vaginal orifice, is known as the vestibule. So the vaginal orifice is surrounded by a thin membrane called the hymen. So in young girls this actually completely covers the orifice, but you get rupture of this fold of membrane, the hymen, with first sexual intercourse or through other mechanisms such as injury. So after perforation of this hymen you get remnants of the membrane which surround the vaginal orifice. So the vaginal orifice is also known as the introitus. So also within the vestibule you've got the opening of two glands. So on either side of the urethral orifice you've got the opening of the paraurethral glands, and then slightly posteriorly and laterally to the vaginal orifice, you've got two glands which open called the greater vestibular glands. So these glands are also called Bartholin's glands, and they secrete mucus to lubricate the vagina. So hopefully that's given you a good overview of some of the key features of the female external genitalia.